Scientists have found the most common and deadliest type of ovarian cancer starts in the fallopian tubes, not the ovaries. That's according to the American Cancer Society.
The assumption that follows is that removing the fallopian tubes might lower the risk that this type of cancer will ever develop. But is that the right direction to go? So here to discuss all of this is Dr. Susan Reed, Gynecological Oncologist with HCA HealthONE. Welcome. Thank you for being here. Certainly, thank you, because certainly a topic that I feel like a lot of us need to talk more about. When it comes to the background of these findings, why does ovarian cancer often start somewhere else?
So we think that there are cells that are in the end of the fallopian tubes that sit next to the ovaries that mutate and form these what we call ovarian cancers, because we often see them more prominently in the ovaries, but that over time we've learned that the fallopian tube is more likely the origin in many cases.
How is tube removal maybe different from getting your tubes tied?
Usually tying the tubes involves either putting a ring or a clip around the middle portion of the tube or removing a portion of the center of the tube. To remove the tube itself involves detaching it from some of its blood supply between the tube and the ovary and actually cutting it at the point where the tube joins the uterus and taking it out completely.
So this is not a small thing, right? So who should consider this? When should someone consider this? How often do you have to have these conversations with patients?
So this is a common conversation that comes up for patients who are already undergoing a procedure that is happening around their uterus. So for example, patients who are undergoing a C-section who do not want to have any more children, that they can have their fallopian tubes removed at that time. When we do hysterectomies for benign indications, then we also recommend removing the fallopian tubes since their purpose is to get an egg from the ovary to the uterus. Then there's no purpose in leaving them behind, and it can decrease risk of ovarian cancer to take it out.
So does this mean fertility is just, not an option after this? How does it impact the ability to have a baby?
So it is still possible to carry a pregnancy after having the fallopian tubes removed, but it has to be done via assisted reproductive technology. So that has to be done through IVF. Eggs can still be retrieved from the ovaries by fertility doctors and can be implanted into the uterus afterwards if only the fallopian tubes are removed.
Wow.
And what does all of this mean for doctors now when it comes to prevention? Has this changed things for you?
So for me as a GYN oncologist, because I'm doing fewer of the preventative surgeries, it doesn't change as much for me, but for providers who are OBGYNs doing C-sections, who are doing sterilization procedures for patients, or for patients who are having their tubes tied, so to speak, for a permanent sterilization procedure, that it's now recommended that we remove the whole fallopian tube rather than just clipping the middle of it or removing a portion of the center.
Such interesting information, important information that all women need to know. Dr. Reed, thank you for sharing with us today.
Of course.